Hello, everyone. I'm Phil Morehart from the American Library Association. I'm the communications manager there. I'm also the writer and editor of ilovelibraries.org, and I'm the host and producer of the How I Library podcast, in case we have any listeners and or readers out there. I want to welcome everyone to the third meeting of the Edi and Neal's Book Club, the ALA Editions and ALA Neal-Schuman Book Club. We're very excited to have Ryan Dowd here with us today. He's the author of The Librarian's Guide to Homelessness. We're going to talk about the lessons relayed in his book and what he's learned about homelessness in libraries since the book was first published in 2018. Hi, Ryan.
Howdy, thanks for having me. Super excited to
Awesome.
be here.
Awesome. Before we get started, I think one thing we do need to talk about first is some words, some terminology. What do we need to know about the current language concerning homelessness in the U.S.?
It's complicated. My perspective is that the words around it, which word you use is not particularly. I don't think it's particularly important, and I say that with the caveat that the reason is that it's complicated. So, a few years ago, the people first language was the thing. And unfortunately, research has shown since then that perhaps that actually increases stigma, not decreases stigma. And I'm all for decreasing stigma, but it seems like language maybe doesn't do that. Now, unhoused is kind of the word of the day. Unfortunately, that one actually is a little more problematic for me. It's actually kind of elitist to presume that an apartment's not a home, that a shared living environment's not a home, that a dormitory can't be a home and whatnot. And so at the end of the day, I find that people that are actually in the situation of homelessness, whatever we want to call them, that they don't particularly care. What they do care about is food, shelter, dignity. And if that's what they care about, then that's what I care about. So, the short answer is whatever word. I just use homeless because that's been the longest running word and seems to resonate with the most people. But you can use whatever you want. It's not gonna offend me.
Yeah, we're going to stick with something that with the way you approach it in your book. You talk about instead of writing perhaps unhoused or people experiencing homelessness, that can be cumbersome in conversation often. So we are going to just stick with homelessness for
That
today's
works.
conversation. And speaking of that, let's step back a bit and get some look at this historically. Um, where do you think homelessness comes from? And I guess on a larger scale, can it be eradicated nationwide or even here in the US?
Yeah. So homelessness, the phenomenon that we experience today in the United States and Canada, Australia, et cetera, is a really new phenomenon. It basically did not exist before the year 1980. I mean, it's only in the last, what is that, 44 years that we've created homelessness. And the longer I do this, the more I'm starting to realize that I think it is, homelessness is the consequence. This is going to sound really weird, so hang with me here. It's the consequence of us having a partially capitalistic system. And what I mean by that is we don't follow full let the market decide when it comes to housing in ways that favor the wealthy. So through zoning laws and whatnot, can't put an apartment building there, can't put an apartment building there, can't make apartments below this size, can't make homes with a yard smaller than this. And the consequences is that we just the intrusion into the housing market completely escalates the cost of housing in ways that the market can't respond to people who just don't have much money. If you look back in the 1800s, you would have found a lot of people living sharing a room, and it was a perfectly acceptable, perfectly normal way to live. That's kind of gone by the wayside, and we've almost created government policy to dismantle and get rid of any type of housing that's truly affordable for people that are struggling. But then we don't go far enough. If we're going to mess with the capitalistic system, then we got to go far enough and actually correct for the damage we've done to poor communities. And we don't do that. We say, oh no, let's let the free market work. And unfortunately, we didn't do that in the first place. And that's what created this. Homelessness is a consequence of affluence, not poverty. That's kind of the first thing you have to know, that poorer communities tend not to have as much homelessness. And the way to think about this is, don't look at who becomes homeless versus who doesn't become homeless, because that gives you a really inaccurate picture. What you need to do is look at where do people become homeless versus where do they not become homeless. Totally different picture. So for example, Detroit, really, really, really high poverty levels. I think it's something like 40% of people in the Detroit area live in poverty, and yet relatively low homelessness. San Francisco, one of the most affluent communities in the country, record high homelessness. The difference between the two is that Detroit has a lot of affordable housing. San Francisco has virtually none. The levels of homelessness in a community are almost 100% dictated by the availability of affordable housing. Full stop. All the factors that we tend to associate with homelessness, mental health issues, substance use issues, minority status, et cetera, speaks to who becomes homeless in any community, but not how many people become homeless in any community, if that makes sense. So if you struggle with substance use in an affluent community, you're more likely to become homeless than if you don't. If you struggle with mental health issues in an affluent community, you're more likely to become homeless than somebody who doesn't. If you're African American living in a predominantly white area, you're more likely to become homeless than the white people there. But if you're African American in a predominantly African American community, then your rates of homelessness are not that escalated. So it's homelessness is very, very counterintuitive because you can't understand it by looking at individuals. You actually have to look at the kind of national phenomenon to really get your mind around it. So
Mm-hmm.
so that's the first part. Can we solve it? Absolutely, we can solve it. I mean, it's only existed for less than five decades. It is primarily a matter of creating enough affordable housing and then providing assistance to people that need a little bit more than just that need the housing, that also need case management, mental health counseling, substance use counseling, but it's completely 100% solvable.
Mm-hmm. And your book provides some guidance and tools for libraries and their part in that eradication. Let's talk a bit about you, Ryan, for some of our listeners and viewers who might not know you. You're the executive director of You've been the executive director of a homeless shelter, a trainer, you're a licensed attorney. You've been a master's degree student in public administration. Your husband, a father. You've had a film at TIFF, the Toronto International Film Festival. Let's talk a bit about your career paths and your life paths and how they've influenced your ideas about engaging with people who are homeless in libraries.
Yeah, so career-wise, originally I actually wanted to be a minister. And when I look back, it was kind of funny because I wanted to be a minister because I thought you had to be a minister to run a homeless shelter. So like I never actually wanted to work in a church. I wanted to work in a homeless shelter, and I thought that was the path. And then during college, my girlfriend at the time, my now wife, she became pregnant, and I didn't care for how the church treated me, treated my girlfriend, treated my son, and became kind of disillusioned. And at that point, realized, wait, you don't have to be a minister to run a homeless shelter. Oh heck, I'll go to law school instead. Then that seems a little more practical. And so went to law school, came out of there, immediately started running the homeless shelter. Did that for like 9 or 10 years. Thought I wanted to be someone else. And so I actually started an organization to work on human rights issues in African dictatorships. And so spent about a year doing some work in Zimbabwe and Swaziland, which was an enormous amount of fun, incredibly dangerous, and just about bankrupted me and my family. And so after that, spent a year running a nonprofit law firm for immigrants out in Washington, D.C. And then the shelter back in Aurora, Illinois, that I had left, asked me if I would come back. And by that point, I realized that I'm wired for homelessness. I'm built for homelessness. My passion is homelessness. And so it made sense to come back. So I came back, started running the shelter again. But in my little sabbatical away, I had built this training for libraries on homelessness. And so I said, hey, actually asked the board of directors, I said, hey, can we start a training division of the shelter where we actually train libraries on homelessness? And the board said, it's a nice idea, but really that's kind of off of our mission. It doesn't really fit the mission. And so I said, well, I'm going to use my nights and weekends and my vacation time to do this on the side then. And they said, great, if you want to work your day job doing homelessness and then use your hobby to do homelessness, that's fine with us. And so I started it as as a hobby, as a little kind of side project, and I massively underestimated the demand from libraries for training on this issue. So.
One thing I think that's really interesting from reading your book is that your experience with working at a homeless shelter, specifically at Hesed House, you started at age 13. It's such a
Yes.
very young age. Do you think if you hadn't had that experience with the shelter, with homelessness at such a young age, you would have a different life trajectory or different your viewpoints towards the issue would be different?
Yeah, so I mean, I went with my church, and I think churches they take the 13-year-olds to the shelter, and the idea is, let's inspire them, let's inspire the kids to have some sort of life of service. And I think I got inspired a little more than the average bear. So in that sense, it worked really well for me. I I walked into the shelter and just immediately felt this connection to the place that I could not. There's just no way I could explain that when I was 13. I couldn't. You can't tell your friends when you're 13 that you really like it down at the local homeless shelter.
Hmm.
But I did. There was just something about it that just felt right. Um, and then when I was 16, this is going to sound like a tangent, but I promise it's not. And then when I was 16, so I was still volunteering at the shelter. But when I was 16, I was dating this girl that we'd only been dating like 3 weeks, but her father died, and I spent the next week or two with the family, kind of helping them to process this and get through this. And then after 2 weeks, she broke up with me. But there was something about that, about being sitting with people on the worst day of their life, being with people who are absolutely just wrecked with pain, that I felt called to. It felt right to comfort people going through excruciating pain. And that kind of just changed, that combined with the shelter just kind of changed the trajectory of my life. And I realized that I need to be working where human suffering is the greatest. And when I scanned the horizon in my suburban Chicagoland area, that the greatest volume of pain was the local homeless shelter, bar none. Um, and so it was really kind of those things coming together, realizing that I am drawn towards helping people out of deep suffering, and then that homelessness is the deepest suffering that we find in our country, that just kind of set me on this trajectory that I probably couldn't get off of even if I wanted to now.
Hmm. And one thing I think was interesting when you talk about the book, a lot of your experiences, it's drawn from Hesed House, which is Illinois. It's a larger metropolitan area, but it's an issue that touches every community across of every size across the United States. And but how much of that you write about in the book is informed by your experiences of homelessness in Chicago or a major urban area versus a small town?
So my experience is primarily suburban and urban. Homelessness is almost identical regardless of where you find it. There are some differences, and the primary differences are around the availability of services. So if you're in a really rural community, you may not even have a homeless shelter, much less substance use counseling or mental health counseling. Transportation is a public transportation is basically non-existent in much of the country. But homelessness, the experience of it otherwise is pretty much identical. People are people, regardless of where they live. PTSD is PTSD, regardless of your zip code. Um, and so the aspect of how to compassionately manage problematic behavior is completely agnostic as to where you apply it. That just doesn't matter at all. How you help people can be wildly different, though, because if you're in a major city, there's probably 15 shelters within 2 miles of the library. If you're in rural America, the library might be the sole service provider in a community, and there's no one to refer people to. There is no one to send people to, and so that aspect is wildly different.
Hmm. Well, let's talk about how you can help people. A major component of your book is something that you write about called empathy-driven enforcement. And I want to can you talk a bit about that, and then you kind of explain why librarians might feel torn between compassion for their patrons, for their homeless patrons, and enforcing the rules, and why you feel they
Yeah,
should.
yeah. So unfortunately, we kind of put ourselves in a tough spot oftentimes of having this dichotomy of, I can enforce the rules or I can be compassionate. And if I enforce the rules, I'm not being compassionate. And if I want to be compassionate, I can't enforce the rules. And that's just a false dichotomy. In my experience, the best way to serve the community and even individuals is to enforce the rules and be compassionate, and particularly to enforce the rules compassionately. That what I've found is that, at least in my experience, and I've interacted with literally tens of thousands of people while they were homeless. People don't take issue with the rules being enforced against them by and large. They take issue with the way the rules are enforced. And oftentimes, if you're homeless, if you're poor, the rules are enforced against you in a way that is incredibly dehumanizing, incredibly degrading. And if you remember that you're working with a population that everybody else is treating them like garbage, if your approach in any way, shape, or form resembles the way they've been treated by everybody else, they're going to respond to you the way they respond to everybody else, which is like you're treating them like garbage. And so you really have to kind of overtly go out of your way to demonstrate compassion, to demonstrate empathy in enforcing the rules, which sounds really hard, but it's actually not.
Hmm. And you provide a plethora of tools for people to use from how to using your head, your mindset to your body language to using your words. One thing I thought was very interesting is some key phrases that people can use. Can you explain that? Like some of your tactics.
Okay, I mean, I've got like 30 hours of training on this,
Oh
but
yeah,
I'll try.
there's
I'll try to condense it down a little bit. So the first thing, and this is not captured as well in the book as I wish it were, is preventing conflict is so much easier than de-escalating conflict. We've done ourselves a real disservice with, I think, even the term de-escalation does us a disservice because it presumes wait until the person is already escalated, wait until the person's already screaming in your face, and then you should take action. You should use these de-escalation tools. And the reality is that primarily because of PTSD being so prevalent amongst homeless folks and many others that are struggling, if you wait until the person's already escalated, it's really, really, really hard to bring them down, to calm them down, because that the amygdala is fired up. Preventing conflict in the first place, so much easier. And so what that looks like is largely around how you approach the person. So there's a big difference between walking up and saying, um, it's past closing time, you need to leave. And even if I say that in a pretty neutral voice, I just dive in. That's completely different than if I walk up and say, "Hi, my name is Ryan. What's your name?" Tony. Tony, nice to meet you. Hey, Tony, it's actually past closing time. I'm gonna have to ask you to leave. That introducing yourself, that little bit of friendliness before you enforce the rules, combined with enforcing the rules with a little tone of sadness that you're kind of sorry for the inconvenience, does just wonders to neutralize the amygdala and keep it from reacting to you aggressively. And then libraries have this additional benefit, which is because they're oftentimes having frequent interactions with the same people and multiple times over they multiple opportunities over the course of a single day to interact. You can do what we like to call getting pennies in the cup, which is these tiny little interactions, these tiny little kindnesses, like asking the person their name, remembering their name, asking if they need any help, helping them, shaking their hand or giving a fist bump if you're cool with the social distancing, um, asking how their day went, chatting about the weather, whatever. These tiny little interactions, what they do is they start to accrue in a way that changes the person's perception of you. And the science behind this is kind of fascinating, and I won't belabor the point with that, but basically there's a point where the person's impression of you shifts to basically the kind of layman's way to put this would be the person stops thinking of you as authority figure and starts thinking of you just as a nice person. Now, when you go to enforce the rules, you're a nice person who has to enforce the rules, which is completely different than this nameless, faceless, authority figure that's kind of cracking down on them. And so, uh, I'm a huge proponent of preventing conflict first, and you do that again through getting those pennies in the cup in advance, and
Mhm.
then starting every interaction with respect before you dive into the rule enforcement.
Yeah, something I was really struck by many things throughout the book, but like, the your enforcement of people first language, listening. I think staying calm is such an important thing. I think people can maybe fly off the handle a little bit. And because I think it's, you talk about the homelessness golden rule, and I think that if people can apply that, it just goes a long way. I want to talk a bit about the trauma enforced framework that you discuss in the book for supporting patrons that are experiencing homelessness, and ways that your advice in your book is or isn't in line with that.
Oh, with trauma informed
Yes.
practices, yeah. So trauma plays a huge role in the training, in kind of the framework as I laid out, because trauma is absolutely ubiquitous with homelessness.
Mhm.
Like the stats basically say that basically 100% of folks who are homeless have experienced very profound trauma. And that if you're looking at the chronically homeless population, 50% of them have full blown PTSD. So they've experienced trauma and they actually have the symptoms of PTSD, which, by the way, is quite a bit higher than soldiers returning from war. Soldiers returning from war is about 1 in 3 having PTSD. Homelessness, chronic homelessness, is about 1 out of every 2. And PTSD really changes the game in ways that if you don't appreciate that, if you don't respect that, if you don't modify your behavior to adjust for the trauma, it doesn't work for anybody. It doesn't work for the patrons, it doesn't work for you, it doesn't work for the library. And so trauma is absolutely front and center of the framework. As far as the trauma informed practices and trauma informed care, I it's complicated because how to put this? I, I agree with all of the principles. I, I don't always find the framework as helpful as it could be because it's almost like we took everything that we can think of that's good and just kind of jammed it under this title trauma informed, which I guess there's nothing wrong with that. I mean, I've actually pulled up the principles here. So it's safety, trustworthy and transparency, peer support, collaboration, empowerment, and humility and responsiveness. Those are all great. I believe in all of those. I think that goes beyond trauma, though. I think all 6 of those apply to whether if the person's struggling with schizophrenia or bipolar disorder or personality disorders or merely poverty. Um, and so the short answer is it's great. It's sometimes not specific enough to be as helpful as I think it could be.
Hmm. What are some of the hardest myths to dispel about people who are homeless in libraries?
Probably kind of the extreme on either side. So on one side, you've got this sense of many people, if not most, have a perception that homeless folks, particularly people that kind of look homeless, are dangerous. And so most people, I think they probably tense up when they cross somebody, when they pass somebody on the street who just is visually overtly homeless. Um, and the reality is that the vast majority of homeless folks they're just not violent. They're not dangerous. But it's pretty hard to convince people of that. The other side of that is this this narrative that's kind of built up that we're all one paycheck away. That but for the grace of God, there go I. And the reality is that no, most people actually aren't one paycheck away from homelessness. And what I mean by that is they might have low financial reserves. You might not have money or might not much or any money in the bank, but most people are actually not one paycheck away from homelessness. And the reason is they have family or friends who would take them in if they lost their housing. So if I lost my housing, my parents would take us in, my brother would take us in. I've got a few friends. I probably have, I don't know, 8 or 10 different houses that I could crash in with my family if I had to. To be sleeping on the street, to be sleeping in your car, to be sleeping in a homeless shelter, you have to not only not have money, you also have to have no one that is willing to let you sleep at their place. And that's not just poverty. That's poverty of finances that's combined with poverty of relationships. If you have money, you don't need friends. If you have friends, you don't necessarily need money. If you don't have either, though, you need a homeless shelter. And so this notion of homelessness is just is nothing more than extreme poverty is just wrong.
Hmm. What evidence is there that homelessness in libraries, or I should say, and also the relationship between librarians and individuals who are homeless, is gendered?
I'm sorry, can you ask the question one more time?
What evidence is there that homelessness in libraries, or the relationship between librarians and individuals who are homeless, is gendered?
I'm not entirely sure what the question
Okay.
means, but I'll do my best to answer it.
Well,
And then you can tell me if I didn't.
you talk a bit about in the book about the disparities and the differences between you have a predominantly larger female staff of a library. We have predominantly uh, a lot of the population is predominantly male. So when you have the disparity and power dynamics, can you speak a bit about that?
Yeah, so absolutely. The homeless population is predominantly male. So I don't know, I don't remember what the national statistics are, but at the shelter I ran, it was 80% male, 20% female. And then always, kind of a few individuals, transgender individuals in the middle that were statistically, not very many, but definitely there. And then you've got the library profession, which is I don't know what the exact stats are, but overwhelmingly female. I mean, I looked at the names of people on this webinar right now, and it's predominantly female sounding names. And so what you end up with is interactions where the patron who's having problematic behavior is usually male, and the person doing the enforcement is primarily female. And that adds a whole extra layer of dynamics to things, whether it is in terms of actual safety or perceived safety, but also it just adds the layer of sexism to the thing. And while I'd love to say that that nobody who's homeless has ever been sexist, unfortunately, sexism is pretty prevalent in every socioeconomic group. And so there's this additional barrier that can be very thin if the individual's just not that sexist, or can be absolutely devastatingly problematic for enforcement if the individual is highly sexist in his approach towards women. And it just adds a whole layer of complexity that has to be dealt with.
Hmm. How did the pandemic impact homelessness in libraries, and what are the ongoing effects of the pandemic?
So, I mean, the pandemic just wreaked havoc on everything related to homelessness. So, during the pandemic, actually, the numbers of homeless people just plummeted because our government just funneled an enormous amount of money into rental subsidies, which kind of proved my point that affordable housing is the solution. But then post-pandemic, we pulled back all of that money at a time of hyperinflation. So housing costs were going through the roof at the same time that the government was withdrawing these housing subsidies. And the result was there are way more homeless folks now than there were pre-pandemic. I forget the exact number. It's like 7 or 8% more. And in many communities, it's much more than that. And so you've got more homeless folks than you had before. You've got more mental health crises. And the reason for that is that many mental health diagnoses can lie dormant until stress triggers them and brings them to the surface. Well, what could be more stressful than a global pandemic? So you actually have more people struggling with mental health issues. Substance use, the pandemic contributed substantially to substance use. You had a lot of people sitting around not having anything to do other than drink. And so you've got higher levels of homelessness, higher levels of mental health issues, and higher levels of substance use issues. And now just let's add one more layer to that, which is somehow in that time frame, we as the American people lost a lot of our sense of civility towards others, particularly towards people serving the public. And so the level of conflict caused by homelessness, mental health issues, substance use, and just it being the world being what it is, has made any type of public facing service dramatically harder than it was 4 years ago.
Hmm.
Um, and it doesn't look like that's going to be subsiding anytime soon, unfortunately.
Um, yeah, since you published your book, you have what to this 2018, since the first publication, what strategies or tools that you promoted in the book have been most successful, and for what reasons, or what kind of feedback have you received?
Yeah, so the one that just hands down gets the most love is the pennies in the cup concept. People that just really resonates with people in a way that caught me off guard. Like, I mean, I like it. I think it's really good. And I think it's actually really essential. Um, it captured people's attention in ways that I didn't expect, though, to the point where, like, I'll go to a library and like all the staff will have a mug that says, get pennies in the cup. And I'm like, oh, I didn't do that. They did that themselves. Which is, I like that because that's getting to the prevention side versus waiting till the conflict is escalated and trying to de-escalate it there. So if anything was going to really get traction, I'm glad it was something in the prevention side.
Hmm. That was the pennies in the cup discussions in your book. I thought were very interesting. Actually, there's much in your book because it works beyond dealing with homelessness in your library. It's something that I think you can apply to your interactions with everyone in your life. Just treating everyone, living an empathy forward life. I think across the board works for everybody.
Yeah. So when I do a live training, inevitably every single time somebody will come up to me afterwards and they'll say, no, I bet this stuff would work on folks who aren't homeless. And I'm like, yeah, don't say. And it's funny because if I called the training, the librarian's guide to people, nobody would buy the book, nobody would attend the trainings. But if we frame it around homelessness, all of a sudden it catches. But the reality is that starting with respect before you enforce the rules, that's kind of a universally good
Mhm.
practice to do. Getting pennies in the cup, building those micro relationships is just universally good. Except for the stuff that is uniquely related to psychosis, it's pretty much equal opportunity. This stuff that works with people who are suffering from profound issues and homelessness, and everybody else, it's pretty universal. But what I find is that there's nothing like it's helpful to do it with everybody. It's essential to do it with people struggling with PTSD, psychosis, substance use disorders, etc.
Mhm. So imagine you're going to be updating the book. What ideas about homelessness would you like to share with librarians now that you didn't share in the book?
I would definitely spend a lot more time focusing on the need to do prevention of conflict over de-escalation. That de-escalation is great, and we'll get there, but prevention is just a lot easier to learn, a lot more effective, um, and just a lot more satisfying way to live your life. So I would definitely start there. I don't know that much my thinking has changed much else beyond that because like in the book I talk about like how can librarians help, and the number one thing is to treat people with dignity. I still believe that the number one thing libraries can do for homeless folks is to interact with them in ways that are dignified. And then everything else is secondary to that, the programs and advocacy and whatnot. Not that there's anything wrong with that, but it's secondary to that. So that's probably the biggest one is more leaning into conflict prevention instead of de-escalation.
Hmm. Well, it's awesome. Well, Ryan, that's all we have for our questions, but I do want to open up the floor to some of our viewers because I know we have a lot of questions. Um, Try to go to the very beginning so we don't exclude anybody. Um, let's start with it's an anonymous question, but for patrons that come into the library who are in need of temporary housing, resources, etc., and all the local shelters are full, churches in the same boat, how else can libraries offer help? They said it feels icky being like, well, we can't do anything. Sorry.
Yeah, it does feel icky. Not to like minimize your ickiness. Imagine being those shelters, getting people, 20, 30 people a day showing up or calling and having to turn away 20, 30 people a day when that is literally your job, is to shelter people. Unfortunately, that is the state we find ourselves in. Um, I was just talking to staff at the shelter at Hesed House, and we actually just expanded the shelter capacity, but to my knowledge, like we're the only shelter in Illinois that's not on a wait list, like literally the only one, unless maybe there's some smaller ones I'm not aware of downstate. But this is the new reality we're finding ourselves in, that shelters homelessness has grown so much so quickly that the shelter system capacity has not increased to keep up with that. And so that's just the reality. What else can you do? Treat the person with dignity. Maybe kind of help them with other needs, because you can't wave your magic wand, snap your fingers, and create affordable housing or create shelter. It's not there. Um, Hand out tents. I mean, I say that tongue in cheek, but maybe not. I think you probably there's a bigger principle here, right? And that is that, in my opinion, the number one thing libraries can do to help people who are homeless is to be libraries, to be that information source, to be that community center. So what does that mean? Obviously, helping people have access to books, helping people have access to computers, helping people to use those, to get that technological literacy, offering those programs that the community needs, being that resource hub where maybe social workers and therapists from other organizations have some nights that they're at your library providing services. Um, do just basically be a library, and you're going to have to let yourself off the hook for not being able to be everything that everyone in your community needs. You're not resourced for it. You're not equipped for it. You're not built for it. And that's okay. It's okay to be a library for the community. I mean, if I'm running the local shelter and the library is not sufficient to meet the library needs in the community, I I wouldn't be expected to step in and create a parallel library system. Libraries don't need to step in and create a parallel social service system. Um, so yeah, I guess do your best, be a library, and show yourself a little kindness for not being able to help everyone with every need.
Yeah, this is interesting. Something you talk about in the book is that you actually recommend against libraries hiring social workers, but rather
Yeah, let me yeah, that's got me in trouble. That's got me in trouble.
yes.
Let me clarify.
But
Uh,
just really quick, you recommend building those relationships with local shelters first, though.
Yeah, I'm a big fan of collaboration. I think anytime that work can be done in collaboration, it's going to be better than being done in isolation. So, for example, when I ran the shelter, we didn't do any of the specialized services. So, mental health counseling was provided on site by another agency. Like they actually had offices in our building. Same thing with substance use counseling. The local law school had a legal clinic on site. We had a full medical clinic that was not staffed by us. And what I learned from that is that when organizations work together, you get multiplication of impact, not just mere addition. Um, Same thing with libraries. I think a library is going to struggle to hire and supervise and equip social workers when that's not what they know how to do. A better model, in my opinion, is to go to the local mental health counseling agency, homeless shelter, whatever, and say, hey, can we help you get resources for you to staff a social worker at our building? If that's not possible, then great, then hire a social worker. But I think there is a slightly better way to do it. So let me be clear, though. I am a huge fan of social workers embedded in libraries. I think that is a phenomenal thing. I think libraries are an absolutely natural hub for services. I just think partnership is a slightly better way to do it than libraries trying to also become social service agencies.
Hmm. All right, let's get to another question. We have, from and again, not another anonymous attendee. We do not have a homeless shelter in my town. We are starting a warming shelter at a church for December through March. Is there another step that we can do to try for a homeless shelter? There's a lot of pushback with the warming shelter because they're afraid they'll be getting a lot of homeless people from the bigger cities that will then run over our town.
Almost every community starts with a seasonal shelter. And then what tends to happen is then December first start date becomes a November first start date, becomes an October first start date. And then the closings, starts creeping back. And at some point it goes to year round. And that's not actually a bad way to go, because going from 0 to 365-day shelter is a really, really, really hard process. There's a lot of things you have to learn. And so not only is there nothing wrong with it, that's a very normal. In fact, I would say that is the predominant way shelters come to a community. Is they start seasonal and then they expand out. So bravo for getting it started. It's a journey from that to having something that approximates adequate services, but it usually starts there.
Hmm. From Kim Reynolds, we have, do you have tips on protecting your own mental health while still adding pennies to someone's cup? As an introvert, it sounds exhausting to constantly be socializing like that.
Yeah, I get it. I'm an introvert too, so I'm going to take a nap after we're done here. Um, yeah, so a few tips. One, you don't try to get pennies in the cup with somebody who sexually harasses you. Full stop. Pennies in the cup is based on kind of acts of kindness and friendliness, which are absolutely mistaken as flirting with somebody who sexually harasses you. So the starting place is, you lose the right to be treated with kind of everyday friendliness when you sexually harass the staff. That's kind of the first place. And then the second place would be kind of figure out what works for you. And what I mean by that is that some interactions are going to be shorter than others. So saying hi, you kind of holler and hi to people as they walk in the door is kind of a low interaction way to kind of get some pennies in the cup versus coming up to somebody and trying to strike up a full blown conversation. So um, I tried really hard to offer tools versus a strict methodology, because what works for you is not necessarily going to work for me. What works in my library may not work in your library, and so it's very much about just kind of trial and error until you figure out what works for you, and then you have your system once you kind of figure out those bits. But for us introverts, it's gonna be harder. But I will tell you, even as an introvert, I personally would rather have 50 little interactions that are tiring than one full-blown conflict where I get screamed at. And those little interactions prevent a lot of screaming. And so in some ways you kind of have to push yourself a little bit into the discomfort of being a pretend extrovert to prevent conflict later.
Hmm. And this is a very similar question, but I'll address it to you anyways, just from Aaron McCarthy. Having to always be the calm one, having to always be the calm one, preventing conflict through overwhelming kindness can become very draining. Do you have any tips on how to keep your stamina up during these draining interactions?
So the research, let me speak a little bit to kind of to burnout kind of more specifically, because I know the research behind that. Um, there's a lot of things that contribute to burnout. There's a lot of things that move away from burnout, and the most obvious is just like the number of hours you work, but that's actually not the most profound from what the research shows. What the research shows are that the two biggest ways to stave off against burnout are having some sense of autonomy in your work, which is a sense of like, have some control of what you do, which if you're in management, let your staff have some control. If you're not in management, assert that you need some control. And then values. Values absolutely guard against burnout. And I think this relate here in the sense that when you feel that your work is in line with your personal values, you are just less likely to burn out than when your work and your personal values are not in alignment. And what I've learned from the shelter is you actually have to work really, really hard to stay cognitively embedded in that intersection between what you do and what you value. You have to kind of spend some time thinking about it and working on that. And that's why I think community is so important. And so for me, I would say that you have to build community in the library, and I mean community between the staff. There has to be that kind of that peer support there. And, it comes down to, you're exhausted, you've been yelled at for the 18th time in that week or whatever. And then you go back to the break room and you're sitting across the table from somebody who knows exactly what you're experiencing. It's probably an introvert like you, as libraries tend to draw introverts. And that community, in my opinion, is the number one way to be able to do the work of world repair day after day after day after day. Because while we love this kind of idea of the kind of the lone, hero figure who's out there alone doing their thing, they don't need anybody, the Marlboro Man, the whatever. The reality though is that people who try to go it alone don't last. They burn out really, really quickly. It's people embedded in a community that can support you and take over for you on days when you just don't have it in you. Those are the people that can do this work for decade after decade after decade. And so I guess what I would say to library leadership is invest in building that community and sustaining that community. That the benefits they're just profound in ways that are really hard to appreciate when you're trying to figure out how to do your job day to day.
Mhm.
Community is just everything.
Awesome. Carissa Bailey writes, how can one argue that unfettered free market capitalism would not have created homelessness if homelessness has only existed since the 80s and massive deregulations happened in the 80s?
Okay, that I'm gonna have to read that question again because that was a really, really deep, nuanced question. How can one argue that unfettered free market capitalism would not have created homelessness if homelessness has only existed in a mass? Okay, so all right, so yes, massive deregulation, but I'm not talking about I'm not talking about like banking deregulation. I'm talking about housing regulation, meaning zoning ordinances primarily. And so zoning ordinances, by and large, just weren't a thing, way back in the day. You could build a mansion, and then right next to it, you could build an apartment complex. And then the kind of suburbia started to take off, and we're like, oh no, we can't let, we rich people don't want to be next to poor people, and so let's create kind of the rich part of town, and we'll create the poor part of town, and maybe we'll forget to create the poor part of town. And in the result of that, saying, no more than, I'm going to make these numbers up because I don't actually know what they are. No more than 8 units per square block. No units of less than 800 square feet, et cetera, forces housing to be a certain cost. And there's just no ability to produce, there's no legal ability to produce housing at a lower cost. If you look at many people who've been in a homeless shelter for a really long period of time, they would happily, gratefully rent an apartment that is, 8 feet by 8 feet, so 64 square feet, but heated, cooled, a roof over their head, and even a shared bathroom. That would be a lovely existence compared to living on the streets or a homeless shelter. But there is no community in this country that will allow you to build a 64 square foot unit. Full stop, period. And the result is that housing regulations force the cost of housing up dramatically, and it just prices out anybody on the bottom of the market.
Mhm. We have an anonymous attendee writes, how can I, as a librarian, help patrons that have a family member or friend that's experiencing homelessness, besides just listening and giving them resources?
I think that's it. Listening, giving resources. And I would say that it's interesting. A lot of libraries have these, like, either a service card or a sheet of paper they have that lists all the services in the community. Ironically, those aren't of much value to people who are homeless, because if you're homeless for any length of time, you've already figured that out, or you died. Quite honestly, you have to figure that out really quickly. It's the merely poor that oftentimes don't know what's available to them in their community, or the friends of people who are struggling who have absolutely no idea what's available in the community. And so I'm not against those sheets, or the cards. It's just they're more beneficial for people you're not thinking about than the people you are thinking about.
Samantha Friedman asks, Ryan, is there a library system you think is working with their homeless population particularly well, and why? Since it's a common issue the librarians struggle to handle, it would be good to see some role models.
there's a lot. I mean, a lot. Things that just kind of pop into my head. I really like Houston Public Library. I think they kind of got it earlier than many. And so for example, they have I don't know if they still do this, but last time I was down there, they have a weekly movie and lunch, and it's down in the basement, and they're going to show a movie, and they're going to have a free lunch that I think was brought in by like another organization that actually provides a soup kitchen, which is again great partnership. Uh, and it's not explicitly, you don't have to be homeless to go there, but the time I was there, everybody appeared to be homeless. And what I liked about that was it was food, it was entertainment, and it was community all baked into one. And I am sure they caught flack for that. I am sure there are people in the community that were like, you're gonna do what? You're gonna turn the basement of the library into a soup kitchen for a day? Like hell you are. Um, you the, I've probably been to 120 libraries in the United States and Canada, and their names escape me. But there's one up in Halifax, Canada, that just the staff went out of their way to kind of curate an environment that was welcoming to anybody in the community. It's really hard because I mean there's just so many that are doing a great job. All the ones that have leaned into creating social work arrangements, whether that's their own staff or outside staff. Ones that have a public health nurse that comes out on site once a month, or a local legal service provider that comes out once a month, or any library that's just really leaning into the needs of the community while still being true to being a library.
Mhm. An anonymous attendee asks or states, I love Ryan's advice and I've tried to follow it for years. Sometimes when I follow, quote, introduce yourself and ask their name, quote, I find that it triggers paranoia in some homeless folks. Why do you want to know my bleeping name? They ask. And I'm met with suspicion or anger. Any advice on how to avoid this outcome or what to do next time it happens?
Yeah. Uh, Number one, make sure you're giving your name first. Because there is a big difference between, hi, I'm Ryan, what's your name? Versus, hi, what's your name? Because hi, what's your name is surveillance versus, hi, I'm Ryan, what's your name is conversation. And I find that introducing yourself first, you're not saying, give me your name. It's here's my name, what's your name? It's very much a kind of an exchange of equals, so to speak. So you absolutely have to share your name first. And then the second piece is look at your nonverbal communication. Paranoia of that level is actually relatively rare. And so if your nonverbal is coming across, like if you're like really, 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 really nervous, you might come across in a way that is threatening the other individual. It shouldn't be, but it is. And so monitor your own nonverbal communication. Make sure it's kind of that light, friendly, airy, respectful tone of voice and body language that's going to project friendliness versus authority.
Mhm.
So those are the two big ones. And then the reality is that there are a tiny, tiny minority of people who, because of a paranoid schizophrenia or paranoid personality disorder, are just wired for paranoia. The problem is you don't know who they are until you run into it, and at that point, then it's just kind of backpedal. If they don't want to share their name, move on. Say like, hey, that's cool. I don't know need to know your name. Just wanted to welcome you to the library. Have a great day. Let me know if you need anything, and move on.
Mhm. An anonymous attendee asks or states, I
Mm.
work for a community resource center that has a good connection with our library in terms of education. We have lots of other resources, including housing help. What are some practical ways that we can get involved with our local library to provide these resources to the community?
Yeah, call them. Get a hold of the executive director and say, hey, we want to partner. You want to meet? I would be shocked if there's a library in the country that would not be ecstatic to have a local agency come alongside and partner with them.
Um,
There's a broader point there. I think the world just works better when people know each other. So, I would go out of my way to know the executive director of the local library, to know the police chief, to know the executive directors of different social service agencies. Um, there is benefit for at least one person, if not many people in the organization, library or social service agency, getting out there and building relationships, because it starts with the one-on-one relationships, and then those turn into organizational relationships.
All right. James Newkirk asks, are there any federal grants or funds available to distribute handouts for those experiencing homelessness, i.e. hygiene kits, blankets, ponchos, etc.?
Not that I'm aware of. That's the answer to that. No.
Yeah. An anonymous attendee asks, what can a library staff do to help people when we live in a community that purposely ignores their homeless population?
Twofold. It's provide, a sense of dignity and hospitality to people who are homeless, and then it's advocacy on the back end. So, uh, call that out. Make the needs of the community known. When you speak as a library staff member, I think you speak with a little bit additional authority on what the community looks like. So, I don't think there's anything wrong with going to city council meeting and saying, "Hey, I work at a library. This is what we're seeing. It appears to me that our community doesn't have the needs, isn't meeting the needs of the community. What can we do about that?" Um, it's not necessarily going to make you automatically popular, but that is how change starts.
An anonymous attendee asks, what are some talking points that can help with de-escalating conversations with third-party patrons who are upset by the smell or noises made by individuals experiencing homelessness?
So what I find is when non-homeless folks are upset about homeless folks, there generally is two major buckets of concern they have. One is, am I safe? Is my family safe to be here? And I think that's an incredibly legitimate question. And then there's this other one, which is, I don't want to have to witness poverty. I am entitled to not have to witness human suffering. And I personally, I have no patience for that. It's like, if you don't want to witness human suffering, then do something about alleviating it. And so because it's not always clear where the person's coming from, I usually advocate a response that looks something like this. We're a library. We serve everyone. We take the needs of all our patrons seriously. We ask all of our patrons to follow the rules, and we also welcome everyone, regardless of socioeconomic and whatnot. And what I like about that kind of two-pronged is it says, we're going to enforce our rules. We're going to create a safe environment. Your safety, your children's safety is absolutely important to me. And we're also going to be welcoming to people that might make you uncomfortable to be around. It's funny. People so oftentimes confuse being uncomfortable and being unsafe. They are not the same thing. And I think you owe it to your patrons to make sure that they are safe. I do not think you owe it to them that they are necessarily comfortable. Because if poverty makes them uncomfortable, sorry, help end poverty then. And then sometimes you just have to kind of agree to disagree. I had an individual call our library, call the shelter to complain because we had a bicycle path that ran right along the shelter. And he said he was tired of seeing homeless people on the path. And he literally said, why don't you have a bigger wall between the library, or between the shelter and the bicycle path? And it kind of ended with me saying, sir, I'm sorry, I think we're going to have to agree to disagree. And, it ended with him screaming at me about how he was going to call the local Catholic bishop and the mayor and whatever. You can't speak compassion into everyone. You do your best, and then you get up tomorrow and do it again.
Alice Walentnes asks, what would you do if a person approaches you about being homeless and you want to help them because they might feel that you think that you are feeling sorry for them?
So the feeling sorry for them is going to be all about your nonverbal communication. If you are talking to them like they're six, like they don't speak English, like they are deaf, like, whatever, they're going to feel condescended to. They're going to feel talked down to. But if you talk to them just like a human being, if someone came into your library and was like, hey, I want to put a screened in porch on my house, and I think I need to get a zoning variance. Can you help me figure out what the zoning, laws are in this community? You'd be like, sure, let me sit down and help you. Likewise, if somebody says to you, hey, I need to know what kind of resources there are in the community for housing, this and that, you can say, sure, hey, let's sit down. I want to help you. sit down with every person and help them address their issues. Leave the pity at the door. Your pity doesn't help them, doesn't help you, doesn't really help anybody. What does help them is the help. And so lean into that. But oftentimes it in almost everything, it's nonverbal communication that's going to get you in trouble, not your word choice. So just be very attentive to, are you talking to them like they're six? You know, because if you're talking to them like they're six, they're not going to take to it too well.
Mm-hmm. An anonymous attendee asks, how can you move up from a lower assistant position into a higher level position in a shelter setting?
As a staff member,
Yes. Sounds like as a staff member.
uh, I mean, that's going to vary by the shelter, but I think most shelters are so starved uh, for talent because, quite honestly, all of our staff keeps getting poached by Chipotle of all places because they pay better. That just, you know, doing your job, doing it well, and maybe doing a little bit more than your job tends to be enough to rise the ranks pretty quickly in shelters, from what I've seen,
Mm-hmm.
and not leaving to go work at Chipotle.
um, Ryan, this has been great. We're going to end the recorded portion of the program now. Thanks so much, Ryan, for joining us today. Also thank our audience. These questions have been great. If you're interested in the book, The Librarian's Guide to Homelessness, and other books from ALA Editions, ALA Neal-Schuman, you can visit the ALA store, alastore.ala.org to purchase it. Don't forget, ALA members get 10% off the book. The book's list price, that is. Edi and Neal's book clubs, we're going to meet next 1 p.m. Central on Wednesday, December 18th, with authors of the books, Libraries and Sustainability Programs and Practices for Community Impact, and also Digital Literacy, Inclusivity, and Sustainable Development in Africa in Conversation. Visit alaeditions.org book club, sorry, to register for that event. Again, Ryan, thanks so much. This has been awesome. Everybody, enjoy your week.
Thank you. It's been fun.
Hey, Ryan, if you are still there, some of our attendees want to know how to get in touch with you.
Yeah.
Just wondering.
Yep. I'm back. Uh, so the easiest is actually homelesstraining.com. That's that's kind of where I live on the internet, is homelesstraining.com. I think if you go to homelesslibrary.com, it'll also direct you over to homelesstraining.com.
Awesome. Thanks again.
Thank you.